Welcome to Mastering and Guideline in Ultrasound and Echo. Hi everyone. In this interesting case study, we are going to learn about one of the uncommon cause of the wall motion abnormality, not due to ischemia, and another important type of the diastolic dysfunction too. Now let's go to our case study. Here we have a 65 years old man that went through to the minimal invasive mitral valve repair due to severe mitral regurgitation. You can see on the mitral valve we have repaired rhinoplasty and other repairing. The patient come to the emergency for chest pain during last week with exceptional dyspnea. The specific pattern of the patient chest pain is that it relieved a little when the patient halfway sitting. And beside of that, there are some suspicious EKG abnormality. Troponin wasn't high too much, a little increased, and the physical exam there wasn't any specific. We didn't have any edema, peripheral edema, and all other lab protocol was almost normal. Here we have the study, echo study, those 4 clips at the present time that was almost 3 months after procedure. And we have one follow-up echo 1 month after procedure at the top row. I put all together the same windows and you can see and compare to each other. First of all, as you can see, there is some specific wall motion abnormality. What is that? Second, what is the mechanism of that wall motion abnormality? Is ischemia, non-ischemia, and what is exactly specific cause of that wall motion abnormality? Third, is that any finding that is different, specific finding that is completely obvious different between 1 month ago and present time? Is that any specific finding you can point out and explain? Because that finding is important to explain the wall motion abnormality we will see on this case. But you have to keep in your mind this all the clips, add the next slide clips, and based on those we have to come to conclusion what is the cause of that wall motion abnormality. Now let's go to the another question. There is one specific artifact, very common specific artifact. Can you mention it? What is that, and how you, without any other study, can you rule out it or not? Is artifact or not? Is real pathology? Now let's go to the next slides. Here we have contrast study on all those to review the same 1 month after procedure and present time or representation of the patient to the ER. And you can compare, see if still you see those differences, and what is does it help you to differentiate it, the problem and wall motion abnormality patient has it. Just look at all those view, and most probably you can find it very easy. Now let's go the next one. Here we have the diastolic study. As you can see, mitral valve, tissue Doppler, and pulmonary vein, and left atrial volume index, and subcostal for chamber view. First of all, and another was, I didn't bring it here, but IVC was dilated and collapsibility was negative. It was less than 50%. Now, based on all this finding, can you now explain the wall motion abnormality or not? Second, what type of the diastolic dysfunction we have here? And last one, how you can prove your diastolic dysfunction? Now, I'm sure most of you have answer for those questions. Let's go to the explanation. As you know, in minimal invasive any intracardiac procedure, we have the same procedure during cardiac repairing. Anything we are doing, just we are going to do have some incision instead of the sternotomy. We go intercostal, depending of the procedure, right, left, upper, lower. There is a small incision and we use based on the technique and the indication. Still, we are going to have pericardiotomy and incision in some part of the heart, including myocardium, atrium, or ventricle. The same is the procedure almost is the same, but with minimal invasive. The name is there. That can be performed robotic or no, non-robotic. Anyway, so on that case, we have to suspicious about any complication of the procedure on the heart, including hemipericardium and pericarditis. And if this case, as you can see, the 1 month after procedure, if you pay attention to these two parts, you will see very specific differences between these two. As you can see, between the interjunction of the right ventricle and left ventricle,